and we wanted to start this evening with some headlines that are concerning for a lot of parents. Spiking cases of RSV around the country. Respiratory syncytial virus can be severe in children, and it usually peaks in the winter months. So it is concerning for doctors around the country that there are hospitals dealing right now with a number of cases that rival those peaks, and we're only in October. So we want to get an idea of what's happening here in Western New York to help keep parents out there informed. So we welcome back to the town hall Dr. Stephen Turkovich, Chief Medical Officer at Oishei Children's Hospital. We're glad you're here on the town hall helping us get some more context behind these headlines. We see places like Minnesota and North Carolina seeing spikes in cases. So what are you seeing here in Western New York right now, and how is it comparing with the normal year?
Yeah, unfortunately, we're no different than the rest of the country. We have seen a significant increase in respiratory viral admissions. RSV seems to be leading the pack in the number of the type of virus that's causing this. Last week, we had over 100 children admitted with RSV and over 200 in the ED tested positive. So this is a little bit earlier than we generally see. RSV usually hits in November and December, but with COVID, we've seen a complete change in our respiratory seasons. Last year, we did see an increase in RSV in September and October. Unfortunately, though, this year is significantly worse than last year.
Help us understand more about what RSV is, why it's so concerning for children, probably most importantly right now, what should parents be on the lookout for as far as it's concerned?
So RSV is a viral infection that can infect anybody, and it causes the common cold in most older people. In children, though, it can cause a lower respiratory tract infection or a viral pneumonia. So it causes a lot of mucus buildup in the little tubes within the lungs, which make it very difficult for young children, especially very young babies, to breathe. So if you're a parent and you're worried, look for increased work of breathing. So working really hard to breathe, maybe some increased sleepiness, often is associated with fever, fussiness, decreased feeding because it's hard for babies to suck and swallow when they're trying to breathe. If you're seeing those things, certainly call your doctor. And if you're really worried, please come to the emergency room.
And is there any indication of why we're seeing this rise in cases so much earlier than usual? And does that now mean that it's going to be a worse season overall?
Well, you know, we've seen the prediction that this overall respiratory season is going to be worse. There's some clues as to why. We know that Australia, which often has the flu season before us, had their worst flu season in 5 years. And that also hit them about 2 months earlier than it usually does. We also saw that in the Southern Hemisphere. So we were anticipating this. The other thing is, because we haven't seen a lot of these viruses, especially RSV, over the last few years because of COVID and all the lockdown measures, there's a large group of people that don't have any immunity to this. So think about it, 2, 3-year-olds never really saw RSV before. So there's a lot more people that are susceptible to this.
It certainly makes a difference. And I was going to say, because this time of year is challenging as it is, because you do have flu season to worry about. And even though COVID cases are much lower than they've been, the pandemic put a tremendous strain on the healthcare system over the last few years as well. Have all these factors made it harder to deal with this kind of spike in RSV?
Yeah, you know, the healthcare system is burned out. We're exhausted from COVID, and it seems like there's one virus that continues to hit after another. But we're here for the community. We're here for everybody. We do plead everybody to please get a flu shot because that will certainly help. Get your COVID booster. In terms of flu, we did have 10 cases of flu last week in the ED, so we are starting to see that increase. And unfortunately, we anticipate that that's going to increase. So we may have a dual pandemic of RSV and flu over the next several weeks. Wash your hands, stay home if you're sick, and please get vaccinated for COVID and the flu.
We know you are a busy person, so we really appreciate your time. We've been talking with Dr. Stephen Turkovich, Chief Medical Officer at Oishei Children's Hospital. Thanks again for being here.
My pleasure.